Now, sir, I would like to ask you a question about our healthcare system. And are you satisfied with the standards of care of the people with diabetes in our country, Pakistan?
Never. Never. We are doing nothing for diabetic people. Officially, I mean. Officially, we are doing nothing.
Yeah.
Because there is no system here. Diabetes is very expensive disease. Very expensive. Number one, people have to pay from their pocket for the doctor fees. And doctor fees ranges from 50 rupees to 3,000 rupees per visit.
God forbid.
Number one. Then so many investigations.
Right.
It is not one investigation. We are all doctors. We know so many investigation for diabetic person. And then medicine. It is not one medicine like TB, malaria, and typhoid.
Right.
So many medication because it is metabolic syndrome,
multifaceted disease,
hypertension, ischemic heart disease, cholesterol, uric acid, and so on.
Affects everything in the body. Yes.
Very expensive, and there is no system. Poor people, they have to pay from their pocket for all these things. And how if monthly income is 16,000 or 18,000, which is average, how you can afford this expensive disease if you are diabetic? And if there are complications like hemodialysis and so on, heart problem, or diabetic foot, how you can bear the cost? I don't understand. There is no insurance system. Government is not helping, I must say, because in civil hospital, JPMC, we see the situation. If you have got Jake, power, source, some doctor connection, then only then you can get. Otherwise, for 1 or 2 days you may get admission or something for long duration. There is no system. There is no primary care system. There is no secondary care system. Tertiary care system, people with simple cough, respiratory tract infection, they come direct to tertiary system. Tertiary care, health care.
So it was like this all the time, or it has become worsened?
Worsened day by day. I tell you, it is worsened. You are right. Because when I was a young doctor, one friend from America, he came to me from America, Pakistani, and he visited me in civil hospital. At that time, it was early 80s or 70, late 70, early 80s. And he was surprised. He said, "Oh, your patients are getting free lunch, free meal 3 times a day, and so much comfortable life." At that time, he was surprised. And unfortunately, these facilities, they are worsened now.
Okay.
Even from at that time. When I was medical student at LMC, people from all over Sindhi used to visit Al-Nafis Hospital in LMC to see our facilities and level of the quality. And now, unfortunately, all things are worsened day by day because health is not our priority. And corruption is so much and everywhere, including health system, corruption. Number one, government spent very little, and out of very little there is corruption.
Yeah.
So we are. There is no planning, no system.
As far as I have understood, that the standard of care for the diabetic population is.
Professor Adib Rizvi is doing something excellent.
Yeah.
Idi Saab doing something excellent. One doctor is doing excellent thing. But there is no system.
It cannot be made better by the NGOs and the.
It is individual effort.
Individual efforts.
System. And if person is there, thank God he is there. One person is there. System. At that time, that institute is running. But there is no system.
You gave example of Dr. Adib Rizvi. He is doing by himself.
His
personal efforts. Then nothing has.
No
government has to do nothing with his efforts. It was only his
I
will.
Must say no.
So,
I organized 2-3 international conferences in diabetes when I was at Doe University, and in one international conference. Governor of Sindh of that time, he was our chief guest.
Okay.
And we suggested him, not only me, our team.
He was your student as well.
Suggested him that look at rural area at taluka level, You start diabetic center,
Right.
and it takes only 23,000 only.
Only?
23,000 to establish diabetic center.
Oh.
How? You need one room, which is already there in hospital. You need 1 or 2 tables, 2-3 chairs, one BP instrument, one glucometer, and some literature. What else you want to start? Diabetic center and primary care.
It was not so hard
Nothing
for him
else.
to do, yes?
But only 23,000 we calculated. And we said that if government cannot bear this expenditure, they allow us, they permit us. Then we will sponsor from pharmaceutical companies.
Then what was his response?
At that time he said, okay, we will do.
Oh, he was.
Then
After all, he was a politician. Yes, his promises were also political.
I cannot say political, but unfortunately, it was easy solution. 23,000 only for one taluka diabetic center in primary care. But unfortunately,
It could be done very easily, but if for this,
there is no vision.
Vision,
no
actually.
devotion,
Yeah, devotion,
no
yes.
thinking,
Yeah.
no policy.
Exactly.
All things are ad hocism.
So quality of care is something which can never be obtained or done without government support.
Public at personal level, we are doing. You are doing. I'm doing. Everybody, every diabetologist is doing it. It's only at his or her own level. But there should be some system, and system will be through government. Publicly, how we can set system all over country?
Yeah.
No.
Exactly.
So initiation should come from government, and we are there to work for betterment of the healthcare system in diabetes.
So you produce a huge number of students in the country, not only the whole country, abroad.
And I feel proud.
And they are not only in the country, but they are abroad. They are doing their services, and this all depends upon you. But what you think is the role of primary care physician in managing giving the quality care to the diabetic?
They are working very hard. They are working very hard. They are first line force, I mean, to treat these patients. But if you talk about PCDA,
I was coming to this point.
You are coming, because I must mention about PCDA. Primary care physicians, they should be the soul of the care of diabetes.
Okay,
soul.
right.
First defense force.
Right.
Primary care physician. They should come, and they are coming actually.
An
primary care.
I know an ex-captain of RB is talking to me. Yes.
Yeah. So they are playing their part at their level, but more can be done. Actually, they are very busy persons. They are devoted, but they are very busy.
Yeah.
Busy, so many patients they see in few hours.
In earning their bread and
butter. They
butter.
cannot give proper time because of this reason, because they are overburdened.
Okay.
But they should keep, in my opinion, if they are claiming that they are diabetologist, one dietitian.
Okay.
One dietitian, multi-purpose.
Okay.
He should dispense the medicine, tell them, counsel the patient.
Yeah.
Okay, this is the prescription, because every patient needs some counseling.
Okay.
This is prescription, but how should I take these medication?
Okay.
Somebody should explain. Then about diet, exercise. One family physician cannot do this himself or herself. Can never do.
Okay.
In such a short period of time.
Okay.
How can he do? So he should keep one multi-purpose.
Okay.
Nurse, educator, whatever you call them. And he or she should, it is better she, because diabetic nurses means most of the time females.
Yes.
Females have got जो आवाज में दर्द होता है तो patient जरा जल्दी समझता है ना. To female educator nurse, she should counsel.
Okay.
Tell them the importance of the home blood glucose monitoring.
Okay.
If we bring this blood glucose monitoring, do it at home 2-3 times a day, write it down and bring the record. She should tell, she should emphasize then educate about diet, exercise to every diabetic person.
You mean to say primary care physician should not become a jack of all trades, but he
Yes.
should be
Yeah.
he should be master of.
He has to spend extra money.
Okay.
Is a pay of the dietitian, but believe me, his time will be lessened. Now instead of 20 patients, now he will be able to see 40 patients because he has enough time now. Counseling is done by educator, nurse educator. So he has got more time, he can see more patients.
Then-
so this money spent on dietitian is
Are not you suggesting
compensated.
a restriction on his role in this?
No, a doctor cannot, everywhere in the world, you see in the developed countries, I am trained at Royal Infirmary, Glasgow. There was a diabetic center over there, endocrine center over there, and there were educated nurses there. And they used to counsel, they used to teach about diet. Doctor hasn't got enough time. He should take history, he will do physical examination, he write prescription. It takes a lot of time.
But sir, in our circumstances, how a family physician working in a village or far place, he could arrange so many people at a
Not
clinic?
so many, only one.
Okay.
Only one, multi-purpose. She should teach how to inject insulin, where to inject insulin, how many types of insulin, how to keep proper storage of the insulin. This is counseling. Importance of the exercise. Tell him or patient about complication. If you don't do this, these are the complication. So this need time. One doctor can never do this.
Will not it put extra financial burden on the patient?
This
indirectly?
financial burden will be compensated, will come back when they will see more number of patients because now they've got time.
Okay.
So they can see more patients.
Okay.
And counseling education will be given by the educator.
That's
you try this,
Yeah.
and you will see the benefits. Sorry. You will
I
see the
understand.
benefit.
This is the experience which you have been facing.
Yeah.
And this
will be the service to
this
the
could be a
diabetic
very
patient.
good.
Proper
So our healthcare system, you are not satisfied with that?
No.
Government are not doing anything positive or
Yes.
supportive enough for the healthcare primary care physicians. But what do you see? Primary care. You talked about an organization by the name of Primary Care Diabetes Association,
PCDA.
PCDA. So, are you aware of such other organizations in the country which are doing something, at least something at primary care level, or PCDA have given this new trend?
There are so many organizations of family physicians in Punjab.
I'm talking about primary care level.
But they are not focused on diabetes only.
Yes.
Like College of Family Medicine.
Okay.
And in Punjab 2-3 organizations, they are not focused only on diabetes.
Okay.
They are doing good job, but for all the diseases.
Okay.
PCDA is only for diabetes, so it is unique, and it is doing great job. Great people are there, and I'm proud that many are my students, my junior colleagues. I'm happy whenever I deliver lecture in PCD. I feel it's my own, like on home. But I think more can be done. More can be done.
Yes, please suggest.
How? Yes, they should involve government.
Okay.
Government.
Yes.
In a way,
Yeah.
I can help. So many other can help. Like every year you do function, symposium, I mean.
Yes.
In that symposium, please ask some government
Official.
minister, acting minister,
Yes.
to become chief guest. Now, it is not like filtering government, no. When they come, we can discuss them. Now, they are our chief guest. They are here for 2 hours with us. Then we can tell them our problems. What difficulties which we are talking now, we can talk them there.
Only at least.
When they become chief guest, they come as a chief guest, they listen.
Yes.
They become sympathetic
Yes.
to us. And then they will listen and then might help. And they will help, certainly. Why not? It is their duty to help
this
our
could
genuine demands.
you're saying the PCDA can be a good medium of communication
Yes,
between government
excellent.
officials and
Why not involve government? I can help in bringing any minister. And so many. You are, mashallah, at high level. You can.
Many of
many connections.
Many of the ministers are also your students.
Yes,
and
sure.
And the governor you are talking about was also your student.
Yes.
Yeah, but
so I think government should be involved. There are some problems because when we ask them to become chief guests, they come late and whole our symposium become disaster. Hijacked of time. Sometimes this happens.
Yes.
But even then we can get benefit.
Okay.
And there should be meeting with secretary, health minister, and we should emphasize them. We should tell them our problems. Tell them that what is the weightage, gravity of the situation of diabetes in Pakistan or in Sindh province, or whatever you say. So I think this should be done, and you are doing excellent job otherwise, but more can be done.
Thank you, sir. You talked about government, you talked about the primary care physicians. And what do you suggest these people like you, sir, who have got tremendous experience in this field and who could support us? But we see that we are not finding support at that extent and level which they should offer us. What do you suggest to your community of professors, community of senior? How can they help us primary care physicians in this regard?
Who will help?
The seniors. I think
research. Please do research. Because we are also fond of research, I tell you. Yes. So if you provide some platform to do research, then this can be done, and we are happy to be there. Whenever you ask us to deliver lecture, we always come. We feel pride in delivering lecture from your platform. So research should be done. In this way, we can help you. We means we teachers can help you.
Yes, sir.
Research, and this is our planning, inshallah. We talked a few days ago about this, and inshallah this will be done, I hope.
Yes.
And otherwise, on any workshop, on any academic session, you may call us.
PCDA
we are happy to be there all the time.
Yeah, PCDA has arranged research secretary and have constituted and formed a research committee as well, and it has started its job, and they are
you may organize free camps,
and
we will be there, inshallah. You are also consultant, by the way. We are also consultant. We will be happy to be with you and doing free medical camp and free consultation.
Okay.
Whatever you ask, we are always there to serve you.
Thank you, sir. Thank you very much.